and I know in your work, you really highlight leaky brain syndrome. So let's talk a little bit about that and what sort of impact that has on brain chemistry.
So a lot of our listeners are probably familiar with leaky gut. So with the leaky gut, well, everything needs to stay inside of its own system, is what I like is the best way to explain it. So like even the vascular system, the blood, our blood needs to stay inside its vascular system, inside the veins and the arteries, contained where it needs to be contained. If you have a hemorrhage inside, if an artery tears on the inside and blood starts leaking out into the rest of the body, it's like battery acid to the body. It's super toxic. Well, it's the same thing for our GI system. All the food and water that we drink needs to stay contained inside of the GI system. And if there is a breach in there, either a micro tears or like openings, as in the leaky gut, where these little doors, these tight junctions become open all the time, stuff can leak through. Or if you actually have an actual tear and anything gets out, it's very, very toxic to the body. And so, when we have leaky brain, it's kind of the same concept. There is a blood-brain barrier. There's a barrier around the brain that very selectively only allows things in, and very selectively can target for things to be expelled out of that area. So it's got like doors in it, kind of like the gut system. It's got doors, and this barrier can be disrupted and it can become compromised from various different things. For many years, it was known that a breach or a disruption in the blood-brain barrier could happen from a physical trauma. So something like, if you get a concussion and you hit your head, that can actually cause a breach in the blood-brain barrier, allowing things to come in that should not come in, like toxins or different types of pathogens. Some people might know that more as infections like bugs or viruses that don't play well in our ecosystem. Now they get a free ticket inside the brain. The same thing with like mold toxins or whatever's floating in the bloodstream, right? That normally would not be allowed to pass through into the brain, now can get through. And the other thing that we have more recently learned that can cause leaky brain is not just like a blunt force trauma to the head, but when we develop what's called leaky gut, which most of us have that because of all of the insult to environmental toxins, the stress that we allow ourselves to be put under, all of these things can cause that. When we have leaky gut, we almost always tend to end up with some degree of leaky brain.
Yep. Yeah. And when we have leaky brain, we're going to have higher levels of inflammation in the brain, because inflammation is really like a survival pattern that your body has to prevent against pathogens from, destroying vital organs like the brain. And so when we have high toxic load, pathogen load, just higher levels of inflammation in general, the brain is going to, for many people, it's going to suffer. And that's kind of at the root there.
Absolutely. And so it's really important, when we're working with people who are chronically sick, whether it's just brain related or they've got chronic illness in their body, which almost everybody that has chronic illness in their body, they almost all, like 99% of them, tend to have some sort of mental issue too, which is understandable. If you've been sick for 5 years or longer, it's going to make you feel depressed. You just want to feel better again. And so when we're working with people, we really like to take this foundational approach of let's clean up the body. Let's pull out all of the toxins, whether it's mold, heavy metals, plastics, chemicals, infections, like whatever's going on in the body, let's clean it up. And then let's seal the systems. Let's close the doors on all of these systemic engines. And then let's start to replenish and give the body back what it needs. And you know what? Just by doing this foundational stuff, David, we see, like, no joke, like over 90% of the cases that we have, their bodies come back online, their body and their brain recalibrates, and these people get better. It doesn't matter what they have going on. When you do this type of foundational work, the body gets better. And this is just a testament to what we talked about earlier, that the body knows what to do. It wants to heal itself. When it cannot, it's because there's something in the way that's preventing the healing. So if we identify what those barriers are, remove those barriers, then the body can get back online.
Yeah. And you're helping people with this with your brain body mastery program. And I know you incorporate some different testing and labs looking at brain chemistry, looking at toxins, things like that. Can you talk more about that?
Yeah, so this program, it's really evolved over the years, and it is a 12-month program. The reason being is because our research and our studies over the years, David, have shown us that it takes an average of 9 months to get mold and chemical toxins out of the body. Some metals we can get out sooner, but as you know, some heavy metals, they do take longer. But, even if a person has a heavy metal like mercury that can take a couple of years to fully extract it out of the body, if they get all the other toxins out, these people are noticing massive improvements in how they feel. A lot of their symptoms and conditions are going away, again, which is a testament to how resilient the body is. But so we take people through 12 months of work, starting with the first couple of months really dialing in on their foods, and some mindset shifts, because it's hard to you can't just give someone a handout and go, well, you can give them a handout and say, start taking these foods and stay away from these. Because, I guarantee you they're going to come back the next month and they're just not really going to have been able to implement. They're going to feel depressed and more anxiety because of changing all the foods. So we spend the first couple of months really diving into getting their mind and their hearts to really resonate with all the changes that they're making. Once we get them into all of the food and dietary changes and some of these mindset shifts, that's where we start going deep into detoxifying them. And we do that for several months, tracking them every few months with labs and advanced assessment forms. In fact, we have our own clients now, David. They are putting together their own case studies. We're teaching them how to track their own progress, what to expect on their follow-up labs, and how to modify their protocols if necessary. Once their toxins are gone, once all these barriers to healing, once all the toxins and stuff is gone out of their body, that's when we go in and we do a really deep gut repair. And then now their body can really replenish all the nutrients that it needs. And that's where, usually it's between month 6 and 9 where the cases that we have who are having a lot of brain chemistry challenges, that's where they usually start to notice a lot of changes. That's not to say that some of them don't notice it within the first 30 to 60 days just from making food changes, because we see that too. But we see a lot of people have those really big transformations between month 6 and 9. And then usually people that are on any type of psychotropic medications, for anxiety, depression, bipolar, like whatever it is, usually in the first 4 months of their second year, they're able to wean off of all of their medications. If they weren't able to do it in the first year, they're able to do it in their second year. Why? Because now all their systemic engines are back up and running. They're online now, they're working. So now for the first time ever, they can start to wean off, and they don't start to have these terrible effects again, because now their body's working. Now they can get off of their medication with their doctor's help, of course, and now they can finally get to experience for the first time how their body's working and they don't need those medications anymore.